Welcome to the Trucking Through Life podcast, where truckers Tom and Michelle discuss angels, spirit, and soul subjects in a down-to-earth manner while providing practical applications for the everyday person. Hello, podcast listeners. This is Michelle.
And I'm Tom, and I'm back.
And welcome to another thought-provoking episode of Trucking Through Life. I have decided that I'm going to start a bit of a series. And this series is going to look at different complementary therapy approaches. Now, a lot of people like to call them alternative therapy approaches, but I like to call them complementary because the research out there shows that if you use traditional medicine in conjunction with complementary medicine, it yields greater results than using one over the other. So that's why I like to call it complementary medicine. And so I have this bag of tricks that I use when I do.
Kind of like your purse.
Yeah, kind of like my purse. So my purse has got a nickname.
It is called the Mary Poppins purse. And if you've ever seen Mary Poppins, which most people have, you find that her purse has no bottom to it. Everything comes out of the purse. That's Michelle's. She was going through her purse the other day and found a wall socket tester.
Yes, everyone has a wall socket tester for a grounding device in their purse,
And
right?
she has a multi-tool device with pliers, knives.
saw. I have a saw.
Yeah. And she had one of those. She also had a wheelchair tool in her purse one time.
TSA took that from me, which I don't understand why they haven't found my multi-tool as many times as I've been through TSA, but they did find my wheelchair repair kit for some reason, and they confiscated that.
Because they needed one.
Oh, is that it?
They're like, hey, we got one over here. We got it.
And of course, everyone carries their podcast microphone in their purse because you never know where you're going to be. Those of you who listen to us know that this is an on-the-go mobile podcast from the cab of our semi-truck.
Our brand new semi-truck.
Yes, we talked about that last time, that we have a new studio.
Oh, yeah.
Yes. And so anyway, for those of you who are new listening, this is a truly on-the-go podcast. It is recorded while we are out and about driving our semi-truck. I'm in the passenger seat. Tom, as always, is in the driver's seat when I am recording because I usually drive nights, and we usually record most of our episodes in LA, but right now we're headed out of LA.
We are in what they call the high desert.
Yeah, we're headed to the Mojave Desert. So anyway, I just, I have all these tools in my purse.
Whoa,
my bag of tricks. Okay?
Red light, green light.
Yes. And so complementary medicine is a lot like my purse. There are a lot of different tools out there that you can use, and you never know which one is for what. So I mentioned this to Tom, and I told Tom I need to start talking about all these different complementary medicine approaches on the podcast because I am actually teaching at the college this fall. I am teaching complementary approaches to medicine this fall. So I'm like, this would be a good way to start introducing people to a more holistic way to heal. So in the past, it's been really our cultural belief. When something's bothering us, we take a pill and it's gone. But something's happened to our vibration level, to our world, to everything. It has changed. And sometimes taking that pill is not getting rid of what it used to in the past. So what I'm doing is offering you an introduction to a lot of different complementary therapy approaches. I will let you know where you can find practitioners because you may not be in a St. Louis area. I, of course, am a practitioner in a lot of the approaches that I am presenting, and when I am not presenting approaches that I don't, or when I'm presenting approaches I don't do, I will have resources for you so you can find people who do. All right? So I think that the reason that our traditional medicine is not working the way that it used to is because we are not the same race, the same humans that we used to be. Things have changed in our world. Now, whether you are aware of it or not, there's not one person out there saying that things are exactly the way they were 2 years ago. Not one person. Everything is different. Everything's changing. And because of that, also the vibration of our body is changing. So remember, everything is energy. We are pure energy. Plants are energy. The air is full of energy. Everything is energy. A textbook is energy. A vehicle is energy. It's just a matter of how that energy is configured to make a form that changes from object to object. And because energy is the root of everything, we can heal much faster if we're incorporating some of these somatic, that's a new term I want everyone to get used to, somatic therapies. What is a somatic therapy? A somatic therapy is a physical therapy, not physical therapy, but it's a physical modality that a practitioner uses or that you use to assist your body in healing itself, that not only addresses physical, but also has emotional, mental, and spiritual component to it, or energy components to it, or associated with it, or tied to it in some way, shape, or form. So I have been trained in somatic approaches since the 1980s. Yes, that long. I have been doing somatic approaches. I was first trained as a concert dancer because in the 80s I wanted to be a dance therapist. I wanted to use movement as a healing modality to help people who have physical, mental, and emotional challenges. Unfortunately, I was so far ahead of my time, there was no program for such a thing. So I went into physical therapy. This is what's really cool. There is now structured programs for dance therapy and using dance and movement as a healing approach for physical, mental, spiritual, and emotional issues. So somatic basically means body-based, but not just body-based. It also has a mind component. It could have an emotional component. Could have a mental, psychological, when we talk about that, mind, physical, also a spiritual component. Energy components, okay? It has energy components. So, some of these modalities, the first one I'm going to talk about today is myofascial release. I have been doing myofascial release for 30 years. In addition to myofascial release, some of the other somatic approaches that you have, or some of your movement-based ones, are Alexander, Feldenkrais, and Pilates, of which I am trained in all of those aspects in the 80s, before mainstream rehab even discovered them. And I use those approaches as a physical therapist to help retrain people who were in rehabilitation, physical rehabilitation. So you also have other somatic approaches like myofascial release, craniosacral therapy, lymphatic drainage. I'm trying to think of some others that are in that category. Those have a little bit of a structural and an energetic approach, and I will go into those in each episode and why those are important to your body. So the first one that I'm going to go into that I've talked about first is myofascial release. This was the first body-based, non-dance or non-movement-based somatic approach that I was trained in. So what is myofascial release? It is now becoming an everyday word, but I will tell you 30 years ago, it was not. We had to really educate our mainstream medical system on myofascial release, what it was and how it worked. And quite often, even to this day, those of us who practice myofascial release are called witch doctors or voodoo ladies, or voodoo men for that matter. So we're creeping up here at the stop sign. So anyway, to understand myofascial release, you have to probably know what the word myofascial means. So let's break it down and make it simple, because it's a lot easier than you think it is. Myo means muscle, okay? Fascial means fascia or connective tissue. So myofascial release began as a bodywork approach that applied light pressure to the body in order to realign or remove snags in the fascial system. So what is the fascial system? The fascia is a webby network of strong connective tissue that runs into your body from head to toe. So everyone's familiar with the skeleton. Skeleton is really dense fascial tissue, okay? But it can go all the way down to the microscopic level. So when you look at it at its most bold presentation, that would be a bone. When you look at its least bold or mildest presentation, it would be a cell membrane. Now, what makes this important? Fascia is strong. It has a very, very strong tensile strength, and it is literally what holds your body together. It holds your organs in place and keeps them from bouncing around and being where they shouldn't be. So you may have heard of people who have Ehlers-Danlos syndrome. Ehlers-Danlos syndrome is a syndrome where the connective tissue is highly elastic. And those people can sometimes, as they age, have difficulty with their internal organs because they're not supported and held firmly in place with the fascial tissue. So, by the way, just because you have Ehlers-Danlos doesn't mean that myofascial release isn't beneficial, but that's another episode. So what myofascial release does is it applies light pressure to this fascial tissue, because fascial tissue is kind of funny. If you go in head first, really driving into the tissue, it's going to push back and it's not going to respond so well. Okay? But if you apply the light pressure, the pressure we apply in myofascial release is equal to the weight of 1 nickel. So think of having a nickel on your skin. That is the amount of pressure that's applied in myofascial release. By applying this light pressure to the fascial system, it works somewhat like the stuck drawer syndrome. You know, if you're really shoving a drawer and you can't get it open, so what do? You push it into the direction it's stuck, and then it comes open. So when we apply this light pressure to the fascial tissue, we are applying a light inward pressure to that tissue to allow it to unlock and ease itself open. Now, fascial tissue is continuous throughout your entire body. It surrounds every organ. So when you think about every organ, you're thinking all your vital organs, probably like your brain, your heart, your spinal cord. You're probably not thinking things like your muscles, your lymphatic vessels. So there's a lot of organs. You're probably not classifying that. Your arteries and your veins, those are all organs of your circulatory system. So it holds every single artery and vein has a layer of fascia or collagen surrounding it. And if you have a hard time picturing this, I'm going to give you a little bit of a picture of it. Now, this might be a little bit gross to some people, but let's pretend you're eating some chicken and then you come across that gristle that's closer to the bone. That gristle is fascial tissue. All right, it's a thicker band. So fascia is in bands and layers. Some people who practice myofascial release like to refer to it as layers of an onion. First, you work on aligning one layer, then you move down to the next layer and the next, and so on and so forth, until you're down to the smallest, minutest of layers. Why do my layers need to be realigned or worked on? That's the number one question a lot of people ask. Well, it's very simple. This fascial system can get stuck, it can get snagged, or it can get thickened. Any of those aspects will cause the fascial tissue to put an abnormal pull on the organs surrounding it. So we're going to compare this fascial tissue to a knitted sweater. I don't know if you've ever had a knitted sweater and then you got it caught on something sharp and then it pulled that thread all the way through the sweater and created a distortion in your sweater. The same exact thing happens with your fascial system. The same exact thing. You have a trauma an illness or a repetitive injury. Sometimes you can even have, I'm going way out there now, you can even have a thought that is damaging to your body and yourself that can even affect your fascial system and cause it not to glide and be as pliable and be as aligned as it should be for optimal health for the functioning of your body. So anything along the disease aspect, I've always said after you have the flu or respiratory illness, anything, if you're coughing a lot or you have, even if you're vomiting or something, you should go and have some work done after you recover, because there are fascial structures that I guaranteed you that have gotten snagged or caught up, and they're going to continue to grow and pull on other areas of the body, giving you difficulty in the future in one way, shape, or form. So myofascial release, when you receive it, is a light touch approach. The therapist places pressure throughout different areas of your body. Especially, they can do this over some of the thickened fascial membranes, which run crossways in your body. Some of those normal fascial membranes, your diaphragm is one. The base of your neck has another.
You do know they can't see you touching your spot.
Yeah, I know you can't see me pointing to these areas, but I'm pointing to these areas.
I just wanted to point out the obvious. I thought it was kind of funny.
I know. Every joint has a transverse thickened area of fascia. Your cartilage is in the fascial family right there. So every joint has a thickened area of it. And then remember that it's not just the thickened areas that can give you trouble. They are all connected. So if you get a snag, let's say you get sick and you get a cough, and even after you're feeling better, you have this residual cough. Well, your diaphragm is probably tied down. It could be very likely that your hyoid is your voice box. There are a lot of muscles with a lot of myofascial connections in your voice box. From coughing, that can be tied down. And all of that can grow. So once one area of fascia becomes tight, it creates this imbalance in your body that keeps tugging at your body, keeping it from operating optimally. And I'm always a proponent of your body is telling you something. If it's telling you something, then there's something you need to look at. So these are some things that I've had people come in to see me for myofascial release or craniosacral. We're going to get into craniosacral therapy in the next session. For the person receiving myofascial release and craniosacral therapy, really the biggest difference that they might notice is the handholds, but it's really to them doesn't even look any different. But there are differences related to the two. But they both do introduce energy from the practitioner into the patient or the client into their body. So it is an exchange of energy. So why do I mention that? Because remember, we are all energy. Okay? So the practitioner is entering that energy into your body with that light touch, that 5 milligrams weight of I think it's milligrams weight of a nickel, whatever that weight of that nickel is. The practitioner is entering energy with that light pressure into your body that transfers into the area that's restricted, and it kind of energetically goes bzzz, and then the pressure allows it to release, and the tissue will begin to unstick itself. It will begin to glide. There is actually a ground substance that is located between fascial layers, and sometimes that ground substance also thickens by entering the energy and the pressure in. It allows the ground substance to begin to glide, which then in turn creates a more conducive atmosphere for releasing the energy restriction that's in the fascial tissue. So I have had a lot of clients come in who have not wanted surgeries. A lot of clients come in who have not wanted surgeries. So when they come in, I say, well, I don't know if we can do this, but let's see what's going on. So I can feel where the fascial restrictions are in the body, as any myofascial practitioner who's highly skilled can. We can feel a direction. We may say, well, let's see, something's coming from your little finger, although they're looking at working on your jaw. Well, what's happened is this little scar on their finger has pulled that fascial tissue all the way up their lower arm, the upper arm, through the shoulder, up the neck, and into the jaw. Just like the snag in the sweater. It might be at the bottom of the sweater, but it's affecting the threads or the pattern at the top of the sweater. And the tighter it becomes pulled, the more it affects that abnormal draw. And you know that sweater just doesn't look the same until that's removed, until that fascial pull is removed. It's the same with the body. So in that aspect, that is not hard to understand. I've had a lot of people come in post-dental work. Post-dental work, even just holding your mouth open for the length of time that it takes to do dental work can cause fascial restrictions. Now, I see more people post-dental work for lymphatic drainage, but we're going to talk about that in the lymphatic drainage section. I see a lot of chronic neck and back pain and shoulder pain. A lot of chronic neck, back, and shoulder pain. I have seen a lot of people for neck pain who are surgical candidates. Of the people that I've seen who are surgical candidates, only one of those people did I say, you know what, I think you need surgery. Because I can tell by feeling the fascia. Remember? And this person actually was a bulging disc. Discs are made of fascia. And I can feel where the fascia is pulling. And if I feel it's like a central location of a disc, and that disc is putting the pressure on a spinal cord, a lot of times the symptoms won't go away until you get some sort of surgery to remove that pressure. But I can also tell when a disc is not putting the pressure and you're just getting a symptom that's more from being on a peripheral nerve. So of all the clients I've seen with neck pain, only one, and I knew it pretty quick into the session, only one of those clients I say, okay, let's try this today. And if you want to try 2 more sessions, we will. But I don't think we need to go beyond 3 sessions, because I honestly feel, in my professional opinion as a traditional physical therapist assistant, and in my professional opinion as a complementary therapist provider, that you need neurosurgery. So that's kind of a nice thing too, going to a practitioner who has experience in both fields, traditional and non-traditional. I'm going to give you another example. I have a large portion of my clients when I first started in practice as a physical therapist were pediatric and orthopedic. So I have a lot of pure pediatric neurology and pediatric orthopedic, as well as outpatient sports orthopedic experience from early in my career. I have a lot of joint replacements from later, but early in my career, a lot of pediatric and orthopedic neurology. So I was working with a client of mine, and they were having a lot of headaches. And I was working with this client, and this was one of my pediatric clients as a physical therapist assistant. And I'm like, I really think this particular client, this child had a shunt. And I went to this child's mother and I said, there is a blockage in that shunt. There is some sort of fascial blockage in that shunt that I believe is causing these headaches. I really can sense a pull in this fascial system related to the stomach. So, in addition to this particular patient was getting ready to go through an elective surgery, which did involve them entering the abdomen. So a couple weeks later, the mom came back to me and said, guess what? I'm like, what? She goes, guess what they found? I'm like, what did they find? She says, they found his shunt was blocked in the stomach region. Okay? So the fascia can tell you these blockages. If you have a practitioner who is highly skilled in palpation and highly sensitive, which I happen to be because I can't even go to sleep if I have a sheet wrinkle, can I, Tom?
No, that's the stupidest thing I have ever. Hang on a minute. This is funny. When I first met her, well, not when I first met her, but she's like, I can't go to sleep. And I go, why? She goes, there's a wrinkle in the sheet. What? All sheets have wrinkles. Oh no, not ours. She has to straighten them out and get every wrinkle out of it. Okay, and here's the other one. If she gets the tiniest little hair on her somewhere, doesn't matter
in
where,
my sock,
in her sock, somewhere,
anywhere.
she is stripping down until she finds it.
Yeah, because it feels like a needle. And that's true. And that is true.
So you should see her after she gets a haircut.
Yeah, after I get a haircut, it's straight home to the shower because I can't even live with myself. Oh, I feel all those little pieces of hair everywhere on my body. Oh boy. So anyway, but there are highly skilled practitioners who are highly skilled in palpation. And if you find one of those practitioners, and remember, I will include some resources at the end of this podcast, also in the notes. So if you're in the St. Louis area, of course, you can contact me, magicmichellewoodruff.com, right there. Contact me through the email form. But there are practitioners out there who are highly skilled in palpation, and we can feel when a surgical intervention is necessary and when it's more than likely not necessary. And I have got to say, on all of my clients that have come to me, I'm thinking just a handful through the years have been surgical candidates, true surgical candidates, from what I can see when they come in and I palpate the system, and I'm like, yeah, surgery is probably your best bet. But other than that, I've seen a lot of neck issues resolved, a lot of TMJ issues resolved, migraines resolved, headaches, weird things. And when I say weird things, I might have someone come to me and say, that feels like there's a band around my waist. Well, and we come to find out they actually weren't far wrong. There was. Their pelvic, transverse pelvic diaphragm was very thickened, and we were able to release that. Or someone might come to me saying anyone that has any weird sensation that might raise the eyebrow of a physician when they go to the doctor and say, doc, something's just not wrong in the side of my foot. I don't know what. And the doctor raises their eyebrow and says, well, I can't see anything. That is a myofascial or craniosacral client right there, I'm telling you. In the making.
I can give you an example of that.
Oh, okay.
If I was to take my right arm and go reach over my shoulder blade and scratch my back, it hurts my shoulder really bad. Mm-hmm. So one day I was at the doctor and I said, hey, whenever I do this, it shoots pain all the way down my arm and down my side. And his answer was, well, don't do that.
Perfect myofascial candidate. Actually, we did find something with palpation, and Tom found it. He has a small nodule back there, and we worked with that. We did not do myofascial release. We used some other stuff to pull some of the stuff out. I'm a big proponent of white oak bark hot compresses for stuff like that. But anyway, so if you got any of those weird things going on, or you don't have to have anything weird going on, maybe you just want to make sure that you're getting a whole picture, a whole body healing, instead of just like, maybe I'm tired of using pain pills for my knee pain or whatever. Let's just use that for example.
Really like them.
I know, but I'm just saying they're not going to work the way they used to in the past for people anymore anyway. So that would be probably a good scenario to try myofascial release or craniosacral therapy. Now, if you are really, really wanting to be holistic, you can also look at if it was keeping you from walking somewhere or going somewhere you wanted to go with your life. But we're just talking straight physical symptoms right now. Speaking of straight physical symptoms, when you get myofascial release and craniosacral therapy, these fascial restrictions are tied into your cell. Now, I already talked about there's an energy exchange that occurs between your body and the practitioner's body. Do not be surprised if that energy does flush out some sort of emotional or mental issue related to that particular area. Because new research is finding, and I used to say this 30 years ago, but I'm so glad there's a bunch of new research now that's backing it up, that our memories are not just in our brain, that some of them are in our body and each and every cell and in the DNA. And so let's say you had an auto accident that caused your knee to hurt. Well, other things related to that accident may also prolonging that knee pain, such as maybe the way you were feeling at that time in your life when you had the accident, or maybe the feelings you have towards that accident. So you can have emotional releases or mental aha moments when you get any form of body work done. That is the norm, people. That's the norm. That is not abnormal. That is the norm. But we have went so far away from being in touch with our bodies and so far away to the pharmaceutical side of things that we totally forgot that is also an aspect of healing. All right? So do not be surprised because in addition to realigning and releasing these fascial restrictions, you're releasing chemicals related to that area. You're releasing emotions related to that area. You are releasing thoughts related to that area. And if this area has been a problem for you for a while, you are going to have an emotion tied to it. You are going to have a thought tied to it. So the myofascial release can also result in, as the other body therapies, emotional or mental releases as well. Those are not abnormal. Those are normal. Okay, so I think that's kind of explained myofascial release. Some things you can use it for, of course, is any sort of pain. You can use it for any sort of condition that's giving you anxiety. Any illness that you've had will have some sort of residual on our body. So any illness, any trauma you've been through, any long form of grief, and I'm mentioning grief and anxiety because these last 2 years there is a lot of grief and anxiety that is out there globally. Sometimes you might even be taking on a pain that is more of what I call a global pain. That's very, very possible. That is not impossible at all. So myofascial release, you can go to myofascialrelease.com. It's spelled myofascial.com. I was trained under the John Barnes approach to myofascial release. Main treatment centers are in Sedona and Paoli, Pennsylvania. So you will not see me listed as a therapist under that site. I am listed under the craniosacral site, but I'm not listed under the myofascial release for Barnes because I have not paid the money to be listed, and their listing is not free as a practitioner. But I certainly have all of my certificates from them. I have taken multiple classes, cervical, thoracic, fascial pelvis, pediatric, MFR1, myofascial release 1, myofascial release 2, myofascial unwinding, blah, 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 blah. Taking a whole series of myofascial courses. In fact, I have just done a contributing chapter to a book that is coming out this fall called Star Seeds Volume 3. And in that book, I talk about healing through movement, and I actually cite what happened to me at a myofascial release class once, and it's pretty interesting. So you can look for that book to come out at the end of summer. So if you want to find a practitioner, you can look on that website. They do have practitioners. However, remember that there are practitioners out there who are not listed on the website, who simply haven't paid the fee to be listed on the website. So if you're looking for a myofascial practitioner, you can call around to different body workers and you can ask them where they've studied their myofascial release and who they studied with. John Barnes is probably one of the largest myofascial release training programs and centers in this country. So there you go. That should do it for today, and that is our What is Myofascial Release. And remember, until next time,
Never drive faster than your guardian angel can fly.
Bye-bye.